All right, so let's talk about blood pressure. So when I think of blood pressure, I think of pipes, right? We have vessels in our bodies, and when you think about your house, you have pipes, within your house. So if you have good blood pressure, the water within the pipes is flowing normally. There's no issue. Everything is going good. If you turn on the faucet too high, like on a hose, water will, push very quickly at high speed. So this is an example. If someone has high blood pressure, your blood is working hard to push to get blood to other organs, right? And then over time, what happens in a pipe when you're doing it too fast? Backup, right? You get backup, you can get a leaky valve, or the pipe can burst. Also in our vessels, if we have debris, plaque, which we call plaque because of cholesterol, diabetes, when you smoke, you have plaque in the artery. So our artery is a muscle. So this plaque starts to stick. It sticks. And then as it sticks more, then there's no space for the blood to flow like a pipe. If you have debris in the pipe, eventually it will clog up and then the water can't pass. And so when it can burst, it can cause an aneurysm. And so that's why hypertension is very important, because it can cause a lot of issues down the line if it's untreated. But basically, healthy blood pressure is if it's 120 or less than 80. So some of these risk factors are similar to diabetes and high cholesterol. And from this whole month, we've been seeing that our diet has a large implication on the diseases that we end up having. So high salt intake, obesity, sedentary lifestyle, meaning you don't work out, you don't do anything, you just kind of sit and watch TV. That will affect you. Stress, sleep is important. Sometimes we're all busy, we're trying to work hard, but if we're not getting good sleep, that can also affect our health. And then smoking, as well as excessive alcohol. And then, of course, we've talked about genetics and family history. So some of these things increase the risk of us having high blood pressure. But as I said, high blood pressure, it's called a silent killer, because people can have high blood pressure for years and they won't know. They'll be fine because it's something that happens over time. You'll start having symptoms when maybe it's clogged up, and that's when people get a heart attack, or they can get a stroke when it gets clogged up in the vessels in their brain, or it can affect your kidneys over time with kidney failure. So that's why it's important to see your physician, get a screening, check your blood pressure at home, even when you feel fine, so that you know where you stand and you don't wait till you have these severe symptoms.